Hi, I'm Liv Sasaki, and I'm the Executive Director of the American Heart Association in Utah. I'm sitting here with Dr. Amanda Donohue today. Thanks so much for taking the time to chat with us about women's heart health today.
Thanks for having me.
Yeah, we're excited to hear more about prevention and hormones. To kick us off, can you tell us some simple steps that women can take to prevent heart disease?
Absolutely. So they're pretty straightforward. So one thing I always talk about is exercise. So we recommend 150 minutes of cardiovascular exercise a week. So for patients, I break it down. It's 30 minutes, 5 days a week, and it doesn't have to be all at once. You can spread it out throughout the week as long as you get those 150 minutes.
I love it. Like 10 minutes at a time.
Exactly. Park far away in the parking lot. Walk your dog, but again, get your heart rate up. It's not just a stroll. It's actually exercise. Yeah. And then the other really important thing, there's a couple things, but be mindful of what you eat. Try to stay away from saturated fats. Red meat is a big offender, high-fat dairy. You can still have dairy, but choose 0 or 1% milk fat products. And then the 3 S's, restorative sleep, manage your stress, stay away from smoking and tobacco.
I love that, and easy to remember, the 3 S's. That's great. So when you think about those risk factors, what kind of conversations should women be having with their doctors to ensure that they know their risk?
Knowing your numbers, knowing what your blood pressure is. And as we age, that goal changes. It actually creeps up a little bit. Knowing what your cholesterol numbers, your LDL, which is your bad cholesterol, your HDL, which is your good cholesterol, and your triglycerides. Knowing what your blood sugar is, if you're pre-diabetic, diabetic, or just kind of going in the wrong direction. And then knowing what a good, healthy weight is. And if you're having a hard time achieving that healthy weight, consulting with a registered dietitian, finding new and interesting ways to exercise, which is hard for everybody. And then there's a lot of new medications on the market that help with weight loss, and talking to your primary care provider to see if you're a good candidate is a good place to start.
Yeah, I love that. A good combination of healthy, behavior, things we can do in our everyday lives, and then also knowing your numbers and having open conversations with your doctor. You mentioned when it comes to blood pressure that as you age, it kind of creeps. Something we've been hearing a lot about is the different stages that women experience in their lives. And so can you tell us a little bit more about the impact that menopause or perimenopause have on heart disease?
Absolutely. So when you enter perimenopause, menopause, unfortunately, it does increase your risk of cardiovascular complications because of the waning levels of estrogen in your body. When the estrogen levels start to decrease, unfortunately, your bad cholesterol or your LDL increases. Your good cholesterol, your HDL, actually decreases, and that type of cholesterol is actually cardioprotective, so you lose that benefit. Your body also manages blood sugar in a different way. Your blood pressure creeps up a little bit, not a lot, but a little bit. And then decades of poor lifestyle choices start to catch up with us. Yeah. So having an awareness that is happening, and most of us have an idea at least that menopause is happening through, symptoms of hot flashes, insomnia, changes in our skin and hair. So these other things that happen are internally, and sometimes we don't realize that they're happening. So creating awareness around that is very important.
Yeah. Is there a specific age range that, women should be mindful of, when to expect maybe some of those symptoms, or, kind of double down on some of those healthy behaviors?
There was a very large study called the Women's Health Initiative, and that explored cardiovascular risk and hormone replacement. And ultimately, this study was done a long time ago. There's been more studies that have come out that have deemed the fact that, you can go on hormones starting around age 45 to about 60 and to do this really safely. Before, they're like, absolutely not. Now it's, if you don't have uncontrolled high blood pressure, you don't have a prior history of heart attack, stroke, or uncontrolled cholesterol, a lot of women are really good candidates for this type of hormone replacement. And working with your primary care provider, you can determine the timing, when to start and stop, what combination of hormones, because there's a whole bunch of different combos you can do, dosage, lowest effective dose for your symptoms is ideal, and there's multiple different ways you can actually take the hormones, whether it's by pill or you can do the patch. And again, depending on your risk factors, sometimes doing the patch or the topical application is actually safer. So working with your primary care doctors is actually really key.
Can you talk a little bit about the fear that women may experience when they think about entering this stage of their life?
Yeah, definitely. I feel that the Women's Health Initiative really put the fear in the public about taking these hormones, for a prolonged period of time. That study had a much older subset of women who'd already been 10 to 15 years past menopause, and that's when they were being started. They already had, some cardiovascular complications. Their risk factors were really high. So my goal is letting women know around the age 45 or 50, absolutely safe. And like I said, some women do have some risk factors that are already there, so they shouldn't be on hormones as long or maybe at lower doses. And just creating the awareness that it's okay to take these medications under the supervision of your doctor or your nurse practitioner or your PA. So I want to take the fear out of it.
Yeah.
Because people don't have to suffer with these symptoms because they think they're hurting their heart.
Yeah. And we think about the healthcare journey as, patients aren't alone, right, when they're working with a provider.
Exactly.
Yeah.
Exactly. And we want people to feel safe taking these medications, and we want them to understand why they're taking them, because if people feel unsafe or they don't understand, they're not going to take the medications, and that's not our goal.
One of the things you mentioned was around research and how it's changed over time or as we learn more. Can you tell us a little bit more about specifically with hormones, what kind of research is needed moving forward?
I feel that more research should be put into duration. With the older studies, it was mostly focused on, much older women, like early to mid 60s and later. And I feel that women do go through perimenopause even in their early 40s or late 30s, depending on your genetic profile. So I think more research into, being on hormone replacement for 25 years, what's the safety behind that? And there is some data, but again, getting that knowledge out to women that under the right circumstances and the right patient population, totally safe.
And we have an opportunity to encourage women to participate in what the American Heart Association calls as our Research Goes Red initiative. Awesome. And so we want to make sure that, women feel excited and confident to learn more about themselves and, of course, being a part of those studies that then tell other women how to care for themselves.
That would be great, because traditionally a lot of the prior cardiovascular studies didn't include a lot of women or people of color. So having, a more diverse database is appropriate.
Absolutely. Well, thank you for your time today.
You're welcome. Thank you for having me.